Health insurance is insurance against the risk of incurring medical expenses among individuals. By estimating the overall risk of healthcare and health system expenses among a targeted group, an insurer can develop a routine finance structure, such as a monthly premium or payroll tax, to ensure that money is available to pay for the healthcare benefits specified in the insurance agreement. The benefit is administered by a central organization such as a government agency, private business, or not-for-profit entity. According to the Health Insurance Association of America, health insurance is defined as coverage that provides for the payments of benefits as a result of sickness or injury. It includes insurance for losses from accident, medical expense, disability, or accidental death and dismemberment. The individual insured person's obligations may take several forms. Premium, the amount the policyholder or their sponsor, e.g. an employer, pays to the health plan to purchase health coverage. Deductible, the amount that the insured must pay out of pocket before the health insurer pays its share. For example, policyholders might have to pay the $500 deductible per year before any of their health care is covered by the health insurer. It may take several doctor's visits or prescription refills before the insured person reaches the deductible and the insurance company starts to pay for care. Furthermore, most policies do not apply co-pays for doctor's visits or prescriptions against your deductible. Co-payment, the amount that the insured person must pay out of pocket before the health insurer pays for a particular visit or service. For example, an insured person might pay a $45 co-payment for a doctor's visit, or to obtain a prescription. The co-payment must be paid each time a particular service is obtained. Coinsurance, instead of, or in addition to, paying a fixed amount upfront, a co-payment. The coinsurance is a percentage of the total cost that insured person may also pay. For example, the member might have to pay 20% of the cost of a surgery over and above the co-payment, while the insurance company pays the other 80%. If there is an upper limit on coinsurance, the policyholder could end up owing very little, or a great deal, depending on the actual costs of the services they obtain. Exclusions: not all services are covered. The insured are generally expected to pay the full cost of non-covered services out of their own pockets. Coverage limits: some health insurance policies only pay for health care up to a certain dollar amount. The insured person may be expected to pay any charges in excess of the health plan's maximum payment for a specific service. In addition, some insurance company schemes have annual or lifetime coverage maxima. In these cases, the health plan will stop payment when they reach the benefit maximum, and the policyholder must pay all remaining costs. Out-of-pocket maxima, similar to coverage limits, except that in this case, the insured person's payment obligation ends when they reach the out-of-pocket maximum, and health insurance pays all further covered costs. Out-of-pocket maxima can be limited to a specific benefit category such as prescription drugs, or can apply to all coverage provided during a specific benefit year. Capitation, an amount paid by an insurer to a healthcare provider, for which the provider agrees to treat all members of the insurer. In-network provider, U.S. term of healthcare provider on a list of providers pre-selected by the insurer. The insurer will offer discounted coinsurance or co-payments, or additional benefits, to a plan member to see an in-network provider. Generally, providers in-network are providers who have a contract with the insurer to accept rates further discounted from the usual and customary charges the insurer pays to out-of-network providers. Prior authorization, the certification or authorization that an insurer provides prior to medical service occurring. Obtaining an authorization means that the insurer is obligated to pay for the service, assuming it matches what was authorized. Many smaller, routine services do not require authorization. Explanation of benefits, a document that may be sent by an insurer to a patient explaining what was covered for a medical service, and how payment amount and patient responsibility amount were determined. Prescription drug plans are a form of insurance offered through some health insurance plans. In the U.S., the patient usually pays the co-payment and the prescription drug insurance part for all of the balance for drugs covered in the formulary of the plan. Such plans are routinely part of national health insurance programs. For example, in the province of Quebec, Canada, prescription drug insurance is universally required as part of the public health insurance plan, but may be purchased and administered either through private or group plans, or through the public plan. Some, if not most, Healthcare providers in the United States will agree to bill the insurance company if patients are willing to sign an agreement that they will be responsible for the amount that the insurance company doesn't pay. The insurance company pays out-of-network providers according to reasonable and customary charges, which may be less than the provider's usual fee. The provider may also have a separate contract with the insurer to accept what amounts to a discounted rate or capitation to the provider's standard charges. It generally costs the patient less to use an in-network provider,